Cabinet is meeting today to discuss the current wave of COVID cases and possible changes to testing requirements in England. Gillian Keegan is the Care Minister. She joins us now from Westminster. Morning to you, Gillian Keegan. Thanks very much indeed for talking to us on BBC Breakfast this morning. I just want to ask you, first of all, about what I've just said in the lead-in to you about the changes to testing requirements in England. What can you tell us?
Well, all I can tell you is we're doing a lot of testing. We're probably testing more per head than any other country in the world. So we're doing lots of lateral flow testing. So obviously the teams are looking constantly at what makes sense and what works, etc. But I don't have any official news or updates for you this morning.
But we have been told, the BBC knows, that ministers are finalising plans for millions of people who test positive on a lateral flow test, now being told that they would not need to take a follow-up PCR test if they're asymptomatic. What do you know about that?
Well, as I say, I don't have any official news on that, but I know that the teams are looking at testing and testing regimes. As I say, we've introduced so many lateral flow tests now that, you know, people are, and they're very accurate, the lateral flow tests. They're really accurate if people are infectious. So I guess they're looking at the regimes all the time in terms of what makes sense. But I don't have any, as I say, official news, but the teams will announce it once they have come to their conclusions.
So we might be able to expect that today?
Well, you may be able to expect some news. I don't know when.
If that were to go ahead, people testing on a lateral flow device would then not make up the official numbers that have been tested via PCR. That's quite a miss, though, isn't it? Because it means that you wouldn't necessarily be tracking all of the cases and different strains of variants that may be coming through.
Well, one of the important things, and it is important anyway, with or without PCR tests, that people, when they take their lateral flow tests, they actually they record the results. I mean, I've got mine here, actually. I needed one to get into the studio this morning. It's really simple. Just go on the website and scan the code, and it automatically happens. It takes no time at all. And we would urge people, you know, we're investing a lot in testing. It's really important for us that we get the feedback loop as well. So if you could please make extra efforts to actually upload your lateral flow test results, that would be very much appreciated in any case.
For whatever reason, the reality is many people are not doing that.
Yeah, and that's why I'd say probably they don't think it's important. They've got the results, they know what to do themselves, so maybe they don't think it's important, but I'd just like to urge them to do so, because it is important. It's easy to do, and I'm sure, you know, most people have been so brilliant throughout the whole of this pandemic, really responding to what we need to do and responding to, you know, getting the vaccinations and to all the various rules and regulations that we've had to put in place to get the balance right. So I would ask that actually the lateral flow tests, we're doing so many now. We're doing, as I say, more per head than any other country. So it really would help if you just took that extra minute or less just to upload your results.
And also, if this goes through, it means that you won't be able to track any potential new strains with such accuracy. Look at the situation that we're in with Omicron at the moment and the work that has been done to track that. We would lose that, wouldn't we?
No, I'm sure the scientists who are working on looking at our overall testing regime will be making sure that we can also genome sequencing, and we can do what we do right now, actually, which is look for those new variants. I mean, clearly not every test is sent to genome sequencing, but we will definitely be keeping that in place, because it's really important that we were one of the first people to spot many of the new variants, actually. So it's very important that we keep that in place, and I'm sure the scientists will have that at the front of their minds when they're looking at any testing regime that we put in place, or any changes to any testing regime that we put in place.
I'm curious to know that if changes are coming, any changes to the testing regime, what's driving them? Is there a problem with the PCR system? Is the PCR system unable to cope with things as they stand?
Well, no, what we've got actually is many, many more lateral flow tests. So yesterday was a record. We sent out 741,000 lateral flow tests to people's homes. We've tripled capacity. That's what we've been working on over the Christmas. So for January and February, we have 350 million lateral flow tests. So hopefully that should sort out some of the short-term supply issues that we've had when people have had to wait a little bit to get their packs. But we're doing so many of these, and they're really really accurate when you've got a very infectious variant like Omicron. So actually what we do all the time is look at what makes sense. We don't need to do things that are unnecessary.
Another thing that we're hearing is being finalised today is the scrapping of the test for entry back into the UK. Would you support that?
Well, again, you know, the scientists who I very much support are looking at what makes sense. And as I say, because the variant is obviously very much here, very much everywhere, actually, this is globally now pretty much the dominant variant. And, you know, the case numbers are massive in every country. Everybody's hitting new records. So obviously, against the backdrop of that, you look at what makes sense in terms of people travelling and travel arrangements. That's why we changed the red list. If you remember, we had a number of countries on the red list straight away, actually, as soon as we heard of Omicron, we put those countries on the red list. But once it had become pretty prolific here, it didn't really make much sense. So we do always have to adapt our systems so that they make sense and they're actually, you know, the right approach for the situation that we're facing.
I imagine one of the reasons for any potential changes to the testing rules is the situation with staff shortages at the moment. Do you have a number on how many people are currently isolating?
Well, as I say, we don't collect that data. There's two reasons why. It's about 1 million, to answer your question. There's 214,000 people from yesterday who tested positive, who will be self-isolating. But we don't know all of the people. For example, if you're unvaccinated and you have been in contact with someone who's unvaccinated, then you are to isolate. And we don't collect all of those people. But all of the positive tests, and we also don't know how many people tested negative on day 6 and 7 and therefore are released from self-isolation. But if you add up the number of people, then there's about 1 million people who will be self-isolating right now. And many of us will know somebody who's self-isolating right now.
Talking about staff shortages, we know, don't we, that there are a number of hospitals in England who have had to declare critical incidents. They're cancelling surgeries and appointments. I know that number has gone up overnight. This will be really disheartening for patients, but also for staff. What would you say to them this morning?
Well, first of all, our NHS staff and our social care staff are absolutely doing the most amazing job. I mean, they really have over the last couple of years, but right now they are under extreme pressure with the Omicron variant, with the number of positive cases and the increase in hospitalisations at this point in time when they always have extreme pressure. So we knew that, and we actually knew that going into this period. That's why we put an extra £5.4 billion of investment to try and get extra staff, get some extra capacity, extra technology to be able to put virtual wards in place, and extra beds and extra capacity with the Nightingales, etc. All of which we anticipated that this was going to be really difficult. We've had 2 years of a pandemic. There's a build-up of people who haven't come forward, obviously, who need electives, and there's a backlog that we need to deal with. And then you've got the unknown of COVID. Well, we now know we've got Omicron, and also flu was a big unknown as well, how much flu we would have this year. We always knew that this was going to be one of the most pressurised winters, and they're doing an absolutely amazing job. And part of one of the procedures that we have with our NHS contingency and resilience plans is actually to declare this critical state, and then they'll work with NHS regional colleagues, and then they'll also work with the local resilience forums to make sure that mutual aid's provided or whatever support is required. So it is part of the escalation process, and these are tried and tested plans. We have these plans in place every winter.
We've heard a lot, haven't we, over the last few weeks, particularly about protecting the NHS, stopping the NHS from becoming overwhelmed. But it does, at what point do you feel the NHS is overwhelmed and we have hospitals declaring critical incidents overnight?
Well, actually, the critical instance, as I say, is a part of the contingency process, and there's many other steps as well to the process. And of course, we've got other things like volunteers, we've got local resilience forums with local staff. There's a whole load of mutual aid. There's a whole load of steps that haven't yet been put in place that are there as well, including the military. The Prime Minister mentioned yesterday that we'd be working to see if there were any specific trusts that did need military support at this time. These are the plans we have in place. That's one of the first steps in the plans that's decided locally by chief executives. But we do have these plans in place, and there are many steps. all over the Christmas period, we have had meetings 2 to 3 times a day, looking at lots and lots of different data and monitoring the data very, very carefully. And we'll continue to do that all the way until we get past this wave of Omicron. And as Sir Chris Whitty said yesterday, we don't yet know when that's going to be.
And in the context of all of that and all the work that's been going on and the meetings and the scientists who are advising you, as you keep talking about, some people are being urged to take their relatives home from hospital rather than leaving them there waiting for a bed. That surely is not a situation that anybody should be in this day and age.
Well, that's definitely not. If somebody needs hospital care, then they should get hospital care. If you're talking about people who are already in hospital, then leaving hospital, that's another thing that we actually put a lot of focus on, making sure that once people are medically fit, they can move into the next stage of the process, either go home with the right support or go into the social care system. So that we put a lot of focus making sure that that part of the process works well. But people who go to hospital, if they need to be seen in hospital or need to be admitted to hospital, then absolutely they should not be turned away. We've put £5.4 billion additional investment into our hospitals, our emergencies, our discharge systems and staffing, etc., to make sure that we have enough resilience to be able to deal with people who need the support of the NHS. So that absolutely should not be happening. What we do have, which maybe some people may be confusing, is we have set up some virtual wards. So some people who have Omicron but don't have very, very severe needs, what we've done is we've got the ability to go home with some equipment and for that to be monitored remotely by hospital staff and for it to be dealt with through medication, etc., through the antivirals.
Just very
so there
briefly,
are some people who are under that system.
Very briefly, because I know we're running out of time. Around 100,000 workers are going to be given daily COVID tests from the 10th of January. How are they going to get those tests? How will they be distributed?
They'll be sent directly to their workplace. Some of them will be maybe sent via a hub and then they'll be distributed within the sector, but they'll be sent directly to the workplace. So there'll be a separate channel. Well, obviously these are on top of the millions and millions that are available, 350 million that will be available for the general channel, but they're on top of those. But it's just to make sure that those critical workers, like for example, the police, border force, the fire, some of those people in the labs actually testing have become critical workers, as you could probably understand, that they have a daily test every day. So to make sure that we pick up any asymptomatic person who may have Omicron and isolate them immediately to make sure that we keep the rest of the critical workers as safe as possible. So that's a specific channel for those key critical workers.
Gillian Keegan, thanks very much indeed.
Thank you.